Right. So today, we are going to attempt a deep dive
Hmm?
into something pretty complex and often misunderstood.
Yeah.
Sexual addiction.
Mm-hmm.
You sent us this article from health.compound, sexual addiction, signs, causes, diagnosis, treatment.
Right.
And you want to know more about it. And honestly, I think it's something that even the experts are still kind of figuring out,
Absolutely.
which makes this deep dive even more fascinating.
Definitely. Yeah. Even just, how do you even call it? We've got compulsive sexual behavior disorder, hypersexuality, it's sexual impulsivity.
Right.
It's almost like the fact that we can't even agree on a name
Yeah.
speaks to how complicated it is.
Exactly. And is it even an addiction?
Right.
Some people say yes, some people say no.
Yeah. And it really has, real world implications.
It does.
It's like, think about trying to get treatment for something that's not even officially recognized as a disorder.
Right, like insurance coverage and things like that.
Exactly.
So how do you know if you're dealing with this?
Yeah.
So what are the signs that it's more than just a healthy sex drive?
Well, the article highlights, several key symptoms.
Right.
But I think one of the ones that, really kind of stands out is this inability to control the urges, even when those urges are leading to risky behavior.
Right, you're risking your job,
Exactly.
your relationships.
Yeah, and it's not even just about how often.
Right.
It's about the consequences.
Right, like it's impacting your life in a negative way.
Exactly.
So then what's driving those urges in the first place?
Right.
What are some of the things that might cause this?
Well, there's a few different schools of thought.
Okay.
One is this psychodynamic perspective,
Right.
which suggests that early life experiences,
Okay.
particularly negative ones, can really shape our relationship with sex later in life.
Right, like trauma from childhood
Exactly.
could lead someone to seek solace or control through sexual behavior as an adult.
Mm-hmm.
Makes sense.
And then you've got the neurobiological perspective, which, looks at the reward system in the brain.
Right, dopamine. We all know about dopamine.
Yeah, dopamine is a big one when it comes to addiction, and studies have shown that people with compulsive sexual behaviors have heightened dopamine activity.
Oh, so like they're getting an even bigger reward response from sexual activities.
Exactly.
Okay, but it's not just dopamine, right?
Oh, of course not. It's never that simple.
Right.
The article also talks about these cognitive behavioral factors.
But?
So, for example, if somebody develops a belief that they need sex to cope with stress or to feel validated,
Right.
that can really set the stage for a very dangerous cycle.
So they engage in the behavior to relieve stress.
Exactly.
Which then reinforces that belief,
Mm-hmm.
which makes it even harder to break free.
Exactly.
Okay, I see. And one thing that surprised me in the article was that they talked about the link between sexual addiction and low self-esteem.
Yeah.
I mean, is that a cause or a consequence?
Probably a little bit of both.
Right, like a chicken and the egg thing.
Yeah. Low self-esteem could make someone more likely to use sex as a way to seek validation, but then engaging in those behaviors can further erode their self-worth.
Right, so it's this vicious cycle.
Yeah, exactly.
So then how do you even diagnose it?
Right.
Especially if there's a big psychological component.
Well, it's tough.
Yeah.
The article even says that there isn't any formal criteria in the DSM-5,
Yeah, that surprised me.
which is kind of wild, but there has been some progress.
Okay.
The World Health Organization,
Right.
in their ICD-11, they've actually included compulsive sexual behavior disorder, or CSBD.
So we're starting to get some recognition.
Yeah, slowly but surely.
But even if something's not officially recognized, I mean, does that make the suffering any less real?
No, not at all.
Right, it's a very real thing for people who are experiencing it.
And that's something we really need to keep in mind.
Absolutely.
So then that begs the question, what do we do about it?
Right, what does treatment look like?
Well, there doesn't seem to be a one-size-fits-all solution, but CBT, or cognitive behavioral therapy,
Right.
seems to be a pretty common go-to for a lot of therapists.
What I thought was interesting about CBT is that it's not just about changing the behaviors.
Right.
It's about changing the thoughts.
Yeah, like actually rewiring those thought patterns.
Right.
So instead of turning to sex to deal with stress, maybe they learn some mindfulness techniques or relaxation techniques.
So you're giving them a different set of tools to deal with those situations.
Exactly.
But what about those deeper psychological wounds that we talked about? Are there therapies that can address those?
There are. Psychodynamic therapy
Okay.
really takes a deep dive into past experiences.
Okay.
Tries to uncover how they might be influencing current behaviors.
Like an archaeological dig into the psyche.
Exactly.
So CBT is kind of the here and now, and then psychodynamic therapy is more about connecting the dots between the past and the present.
Exactly.
Okay, and then what if this is impacting a relationship? Is there a way to work on that specifically?
Absolutely. Couples therapy can be really beneficial in those situations.
Right.
It gives the partners a space to communicate openly, to rebuild trust,
Yeah.
to rediscover intimacy.
Yeah, because often the addiction is really just a symptom of deeper problems in the relationship.
Absolutely.
It's like peeling back the layers of an onion.
Yeah, you've got the individual struggles, you've got the relationship dynamics, and then you've got this societal stigma.
Exactly, layered on top of it all.
It's complex.
Which is why I think it's so important that we're talking about it.
Absolutely.
Right, the more we talk about it, the more we break down those stigmas and hopefully create space for healing.
Couldn't agree more.
Now, I know we've just scratched the surface here.
Yeah.
But the article also mentions medication as a potential treatment option.
It does, but it's important to note that medication's not a cure-all.
Right.
It's typically used to address very specific symptoms,
Okay.
like anxiety or depression, which may be contributing to the compulsive behaviors.
So it's more about managing those underlying factors
Exactly.
than like treating the addiction directly. So how do you know which treatment approach is right for you?
That's a great question.
Yeah.
And honestly, it really speaks to the importance of seeking guidance from a professional.
Okay.
A qualified therapist can really assess your individual needs,
Right.
help you develop a personalized plan,
Okay.
help you navigate the often very complicated world of, what resources are out there,
Right.
support groups, specialized treatment centers.
So it's about finding the right fit,
Exactly.
both in terms of the therapist
Yeah.
and the type of treatment.
Mm-hmm.
Okay. So once you've started treatment, then what does that road to recovery look like?
Well, it's not a straight line, that's for sure.
Okay.
It's a journey.
Yeah.
There's ups and downs, there's setbacks, there's breakthroughs.
Sure.
But I think one of the most important things is having a strong support network.
Yeah.
Having people that you can trust who understand what you're going through
Right.
can really make all the difference.
And that's where things like Sex Addicts Anonymous can be helpful.
Absolutely.
Right? That community, that shared experience,
Mm-hmm.
being able to support each other.
Yeah, because the shame and the isolation that can come with this condition can be incredibly debilitating.
So knowing you're not alone
Exactly.
can be very empowering.
It's huge.
I like that saying, burden shared is a burden halved.
Absolutely.
And speaking of sharing, the article also talks about the importance of communication with loved ones.
Yeah,
But that can be tricky.
it can.
Finding that balance between being honest and also setting boundaries.
It's a delicate dance for sure.
It is. You don't have to divulge every detail.
Right.
But being able to talk about what you're struggling with and what you need
Mm-hmm.
in a way that feels safe and supportive.
Exactly. And for some people, that might involve seeking guidance from a therapist or a counselor who can help them navigate those conversations in a healthy way.
So recovery is about the inner work,
Mm-hmm.
but it's also about that external support system.
Absolutely.
It's about addressing those deeper beliefs, those thought patterns, developing healthier ways to cope,
Mm-hmm.
and surrounding yourself with people who can support you on that journey.
You said it beautifully.
It's a lot, isn't it?
It is. It's mind, body, and spirit. It's
Yeah.
a holistic process.
Absolutely.
And as challenging as it may be, the rewards are immeasurable.
So true. Now, we've talked about a lot,
We have.
but there's one big piece that I think we haven't really touched on, and that is the societal stigma surrounding sexual addiction.
Right.
Like it's shrouded in this cloak of shame and secrecy.
It is, and it makes it that much harder for people to come forward and ask for help.
Exactly. And that silence can be incredibly damaging.
Absolutely. It isolates individuals, it perpetuates harmful stereotypes, and it prevents us from having really important conversations. That could lead to understanding and support.
We're going to take a quick pause here.
Okay.
But when we come back, we'll dig into that very topic.
Sounds good.
We'll explore, where does this stigma come from? What's the impact on individuals and their families? And most importantly, what can we do to change it? So stay with us.
All right.
Welcome back. So before the break, we were talking about this stigma
Yeah.
and how it can be so silencing for people who are struggling. So where does it even come from?
Well, I think it really comes down to our cultural norms and, our beliefs about sexuality in general. We live in a society where sex is often viewed through this lens of morality and judgment and shame.
So instead of seeing it as like a health issue,
Right.
it's seen as like a personal failing,
Exactly.
a moral failing,
Mm-hmm.
lack of willpower.
You got it.
And that judgment can be incredibly isolating.
It really can, Imagine feeling trapped in this cycle.
Right.
Knowing that it's causing harm, but feeling too ashamed to reach out for help.
Yeah, it's heartbreaking.
It really is.
It's like the stigma itself becomes a barrier to recovery.
Exactly.
Like you're already struggling with the addiction, and then you have this added layer of shame and judgment on top of it.
The double whammy.
And the article even talks about the impact that this has on relationships.
Oh, absolutely.
It's not just the individual who's suffering.
Right.
It ripples out and affects partners, families, friendships.
Yeah, if you're carrying around that secret, that shame,
Mm-hmm.
it's going to create distance in your relationships.
Right. It erodes trust, makes communication difficult,
Exactly.
really puts a strain on those bonds.
Which is why I think it's so important to talk about it
Yes,
openly.
to shed light on the fact that this is a health issue,
Exactly.
not a moral one,
Mm-hmm.
and that people who are struggling deserve compassion and support,
Absolutely.
not judgment and condemnation.
And understand.
Because let's face it, this isn't something people choose.
Right.
We talked about this earlier, like there are often these deep-seated psychological factors at play.
Mm-hmm.
Trauma, low self-esteem,
Right.
ingrained thought patterns.
It's about understanding, the complexity of being human.
Right.
We all have our vulnerabilities
Mhm.
and, offering grace to those who are struggling.
And that includes recognizing that recovery is possible,
Absolutely.
that with the right support,
Mm-hmm.
people can break free from this cycle
They can.
and rebuild their lives.
Yeah. The article highlights all sorts of different treatment options,
Right.
therapy support groups,
Mhm.
all these things that can help people heal.
And I think it's so important to emphasize that seeking help is a sign of strength,
It is.
not weakness.
Huge sign of strength.
It takes courage to face your demons,
It does.
to acknowledge that you need support,
Mm-hmm.
and to reach out and ask for it.
One of the most courageous things a person can do.
Yeah, and the journey may be challenging,
It will be.
but the rewards are immeasurable. Now, I'm curious, from what you've seen in your work,
Mhm.
what are some of the biggest misconceptions that people have about sexual addiction?
Well, I think one of the most common ones is that it's just about having a high libido
Right.
or being promiscuous.
Like, it's just about the amount of sex.
Yeah, exactly.
But we've talked about this. It's so much more than that.
It's about the lack of control, the distress,
Right.
the impact it has on your life and relationships.
So it's not the amount of sex.
Right.
It's the control, the impact, and like the reasons behind it.
Exactly.
Another big misconception, I think, is that this only affects men.
Yeah,
But women struggle with this too.
they do. And they may even be less likely to seek help
Right, because of the shame.
because of the stigma. Exactly.
So how do we as a society start to change that?
Well, I think it starts with education.
Okay.
The more we learn about it,
Yeah.
the more we understand that it's a health issue,
Right.
not a moral failing.
And that understanding can hopefully lead to compassion. Allows us to see the human being behind the behavior,
Exactly.
the pain, the struggle.
It's about shifting that narrative from judgment to empathy.
Yeah, and I think that starts with conversations,
It does.
like the one we're having right now.
Absolutely.
Creating those safe spaces where people can share their experiences
Yeah.
without feeling shame or judgment,
And challenging those stereotypes and misconceptions
Right.
whenever we see them.
whether it's in our personal conversations on social media,
Mm-hmm.
even in the way that these issues are portrayed in the media.
Sure.
Moving away from sensationalism
Right.
towards a more nuanced and compassionate understanding.
Exactly.
The article asks this question, what's considered too much sex?
Right.
And there's no easy answer to that.
Not at all. It really makes you examine your own values and beliefs
Yeah.
about sexuality.
What might be too much for one person
Right.
could be perfectly normal for somebody else.
Exactly. It's about recognizing that there's a whole spectrum
Hmm.
of sexual behavior.
And what matters is the impact
Exactly.
that it's having on the individual
Mm-hmm.
and on those around them.
And if it's causing distress, if it's leading to negative consequences,
Yeah.
that's when it's time to reach out for support.
And that's where those resources we talked about
Right.
can be so helpful.
Therapy support groups, online forums,
Yeah.
all those things can provide a lifeline.
And recovery isn't just about abstaining from the behavior.
Right.
It's about addressing the root causes.
Exactly.
It's developing those healthier coping mechanisms
Mm-hmm.
and creating a more fulfilling and meaningful life.
You nailed it. It's about healing growth transformation.
Speaking of transformation,
Yeah.
I kind of want to shift gears for a minute
Okay.
and talk about technology.
Right.
The article doesn't really mention this explicitly,
Right.
but I think it's important to acknowledge the impact that the internet and social media have had on sexuality.
Oh, for sure. I mean, the internet has made pornography so accessible,
It has.
and social media has created all these new avenues. Right.
For, seeking out sexual connection.
And while these things can be used in healthy ways,
Absolutely.
there's also like a darker side.
There is.
They can fuel compulsive behaviors,
Mm-hmm.
create unrealistic expectations,
Right?
and even contribute to like the objectification and exploitation of others.
It's a complex issue for sure.
It is.
And I think we need to be having these conversations about the potential risks and benefits.
Right. Especially when it comes to sexuality.
Exactly.
And I think that includes talking to young people about digital citizenship,
Yes.
about how to navigate these online spaces
Mm.
safely and responsibly.
Giving them the tools and the knowledge to make informed choices.
Because ultimately, it's about promoting healthy sexuality,
It is.
both online and offline.
Right.
It's about creating a culture where people feel comfortable talking about these issues,
Yes.
seeking help when they need it, and supporting each other on this journey.
Couldn't have said it better myself. I think that's a good place to pause.
Okay.
When we come back, we'll wrap up our deep dive into sexual addiction with some final thoughts and key takeaways.
Sounds good.
So stay with us. Welcome back to the deep dive. We've been spending this episode really trying to unpack this complex topic of sexual addiction.
Yeah.
And I feel like we've covered a lot of ground.
We have from the symptoms to the causes to the stigma surrounding it.
Right. And the road to recovery.
It's been a journey.
It has been a deep dive.
Yeah. And it's amazing to me how for a condition that affects so many people, there's still so much silence
There is.
and shame around it.
It's true. It's like it's this big secret that people are grappling with behind closed doors.
Right.
Afraid to talk about it.
Afraid to ask for
For
help.
fear of being judged.
Exactly. And that silence can be really damaging.
Yeah.
It isolates people. It perpetuates those stereotypes.
Right.
And it prevents us from having these important conversations.
Which could actually lead to understanding and support.
Ex-
And I'm thinking back to something you mentioned earlier about how there isn't even like a universally agreed upon definition
Right.
for sexual addiction.
It's true.
Do you think that contributes to the stigma?
I think it definitely plays a role. When there's confusion about what something is, it's easier to just dismiss it,
Right.
to write it off as something else, or to blame it on like personal failings rather than recognizing it as a legitimate health concern.
It's like if you can't even name it, how can you address it?
Exactly.
And that's why I think it's so important to talk about these things.
Absolutely.
Bring it out into the open.
Bring it out of the shadows.
Right.
The more we talk about it, the more we normalize it
Yeah.
as a health issue.
And hopefully chip away at that stigma
Exactly.
and create space for healing.
Absolutely.
And that healing can take so many different forms.
It can.
We talked about therapy,
Yeah.
support groups, having that strong support network.
Right. But I also think self-compassion plays a huge role.
Yeah, I was just thinking about that.
Because so often,
Yeah.
people who struggle with this are so incredibly hard on themselves.
They are.
They're filled with shame, guilt, self-loathing.
And that just keeps the cycle going.
It does.
If you're constantly beating yourself up.
Yeah, you're not going to have the energy to change.
Yeah.
So cultivating that self-compassion is so important.
So important.
Recognizing that you're human, that you're worthy of love and forgiveness,
Even in the midst of your struggles.
especially in the midst of your struggles.
It's about treating yourself.
Yeah.
The same kindness that you would offer a friend
Exactly.
who is going through something difficult.
And that can be a really powerful shift.
It can.
Because when you start to treat yourself with compassion, it opens up the possibility for change.
It does.
You start to see yourself not just through the lens of your addiction,
Right.
but as a whole person.
A whole person with strengths and values and aspirations. And those things can become the fuel for recovery.
They can.
Reminding you of who you are beyond the addiction and what you're working towards.
I love that.
So as we kind of wrap up this deep dive, well, I'm going to circle back to that question that the article posed.
Yeah.
What's considered too much sex?
Right. And as we've discussed, there's no easy answer.
There isn't.
But I think it's a question we need to keep asking ourselves.
We do.
Both individually and as a society.
Right.
Because the answer isn't about like imposing rules or judgment.
Right.
It's about understanding the context, the impact, the underlying reasons for those behaviors.
It's about recognizing that sexuality is complex.
It is.
It's multifaceted.
There's no one-size-fits-all approach.
And it's about creating a culture where we can talk about these things openly,
Absolutely.
honestly, without shame or judgment.
Where people feel safe to ask for help.
Yes.
And feel supported on their journey to healing.
I think that's a beautiful vision to strive for.
I do too.
And I hope that, this deep dive has contributed in some small way to that conversation.
Yeah, I hope so too.
To our listeners, thank you for joining us on this journey.
Yeah, thank you.
We've covered a lot, but this is really just the beginning.
It is.
There are so many resources out there.
And you're not alone.
You are not alone on this path.
If anything resonated with you today, if you're struggling or if you know someone who is cool, please reach out for help. There's hope, there's healing, and there's a community out there waiting to support you.
And on that note, we'll bring this deep dive to a close.
Oh, okay.
Until next time, keep exploring, keep questioning, and keep diving deep.